So again, housekeeping, just put your questions in the question box in the upper right-hand corner of your screen. It has a question mark, so it's easy to see. Next. So I think you know Geoff and I and how to get a hold of us based on the email box or the inbox we have. So we appreciate the opportunity to help you all. And the newest addition to our team, she's actually been with us probably since the beginning of the year. She was a former employee from the group space that we have and moved over to help us. And she really maintains sort of the help box, right? Any of the issues, it kind of she helps us and frees up our time to help all of you with other things rather than service issues. And we get involved. She involves us when she needs a little extra firepower behind her requests. So that's what we do. Next, Jeff. All right, it's here. You know, it's here. It's been here for hard to believe it's going to be nearly a month. So let's just get going, Jeff, straight into it. They know
Okay.
when it is.
Yeah. Yeah. So the ACA by the numbers, it's really taken off in the past few years. In fact, over the last year or so in Ohio, it's received like 60% increase. And a lot of it had to do with people coming off of Medicaid. There were a ton of people on Medicaid during COVID. So that accounted for a big increase. So we're up to nearly 500,000, and we expect maybe 10% more for the upcoming year. A lot of prospects in each of Ohio's 88 counties. Okay,
I
let's
suspect
see.
the short term maybe had something to do with it as well,
Mm-hmm.
to a small degree.
Let's see if okay. This is a chart you can put on your bulletin board. This is the 2025's poverty level um, bracket or spreadsheet. Essentially, Ohio begins at 138. 138% is the threshold for um, starting your subsidy for the ACA. Below 138, they'll put you into Medicaid. So a household with 137 and below, they'll send you into Medicaid. 138 is what I mean by that is 138% of um, the income
FPL.
amount, FPL, federal poverty level, and then it sort of ramps up there. So this is nice to have, and as you can tell, somebody with a family of four, 124,000, they still get a subsidy. And it's, in fact, somebody making more than that can still get a subsidy. So they go to like
It's small.
8.5%. Let me
It's
talk on
small.
this. Oh, go ahead. Go ahead, Brad.
No,
Go ahead,
that
Brad.
subsidy at that level, it reduces obviously. So it's
Yeah.
not going to be like they get, that's just kind of near where it phases out.
Okay. And just a word about the FFM consent form. This is baked into the application process. As you're aware, the feds have mandated that everybody um, complete a consent form when they're doing an application and keep it on file for a period of time. Agents need to keep these on file for 10 years. And we have a copy of this consent form on our website in the resource center. But essentially, it's a two-part consent and review form. And you'll do the first half of it, the consent aspect of it, at the beginning of your enrollment, and it's all right there. You're getting the consent of the client to work on their behalf, and then at the end, you'll also follow up with this second paragraph here. I understand the agent will not use or share my PII, and I confirm that the information I provide on the marketplace eligibility app is true to the best of my knowledge. So this aspect, this part of the form, that gets asked at the conclusion of the application. And if you're wondering, boy, this is problematic, or maybe I use a different format. If you use HealthSherpa, they also have the consent form baked into their process. So you can use the Health Sherpa method, and it also asks these questions in that process. So however you're doing the application, they need you to do a consent and review. And really this comes down to trying to combat the bad actors. There's hundreds of thousands, if not millions, of unauthorized applications in the past couple of years, and CMS is finally cracking down on this. They started this in July, and they want to make sure that the writing agent who's writing the case is the lawful writing agent, is the one that the client has consented to. So, one agent, one NPN, it all has to be authenticated through the whole process. And so it also is going to start addressing, clients that were previously enrolled in a ACA plan. We have to authorize the new agent and their NPN. And this does pose a problem for agents who are taking on new business or maybe rolling a book into theirs. So you'll have to, work with the client in authenticating the whole process, authenticating their ID, your ID. How do you do that? Well, you'll either have to do it through the enrollment platform or on a three-way call with the consumer at the marketplace. Okay, and that was a real bone of contention early on OEP, but thankfully Health Sherpa has streamlined this process, so you don't necessarily have to do the three-way call every time. And so there's a process with the enrollment platforms like Health Sherpa for you to do this without necessarily going to do the three-way call. And let me go to the next slide. Let's talk
Geoff, can I
about this
just
Health
interject
Sherpa
real quick?
solution. Go ahead. Go ahead.
Yeah, just FYI, guys, we've been hearing from some of you that wait time calling into CMS is about a 25-30 minute wait before you even talk to somebody. So I don't know why they didn't think that maybe one third to half of all of those 24 million people were going to switch brokers. So I think I ran the numbers. They would need to field about 120,000 calls a day in order to make that happen. So that's a really low percentage. So this Health Sherpa option really that Geoff's going to preview to you because he sat on a lot of the development
Mhm.
calls with Health Sherpa
Yeah.
is going to be the easiest solution or the most expedient solution for you. So take it away, Geoff.
Yeah. So my recommendation is if you're taking on a new client, use the Help Sherpa workflow. Use their workflow to authenticate your NPN with the client. And, essentially, when you're working on Health Sherpa, you've got a new client, you do the application, you have to go out to the marketplace and search for their current application. And in that your NPN is not associated with that app at that time, you'll get an error message from CMS called the invalid action error message. And this is literally what the error message looks like. Okay, you can't update the consumer's policy right now. And there it is. There's the phone number they want you to call for the three-way call. But wait, you don't necessarily have to do that. Okay, so instead of doing that, um, you can submit the changes through Health Sherpa, and you don't need to create a new application. The whole process is built into this presentation, and there's links to it, so you can learn more about it. But essentially, you're going to have the client make the changes, okay? And what you'll do is, start the whole process and do the update. When you encounter the error, um, send the consumer their in progress application. You may need to send the in progress application by emailing the resume link. Okay, there's a resume link in your client screen. That's the key. You got to find that resume link, and that starts the whole process. And that's where you will be emailing that directly to the client. And the whole process is built in to Health Sherpa. And this is the screen that they'll see. Okay. I have definitely more information to share with you, but this is the update that the client will see. And this is what
Consumer.
the client will do here. And so what you'll do is the consumer will be required to have their identity verified in order to proceed. And this will be emailed to you. The experience using the resume link FAQ is right there. And I don't want to spend too much time on it, but that's the process. And in the follow-up, we'll send you more information so you see a step-by-step, screen-by-screen process. Option 2 is to call the marketplace. And like I said earlier, that can be problematic. As Brad said, it could take up to 20 minutes on hold, but that's another option you can do. I don't recommend it. Currently, a lot of my agents doing the resume link error workaround on Health Sherpa have experienced pretty easy workflow and able to do it in about 10 minutes.
Yeah, and
So,
I know that was pretty small, right, to read. So you're all going to get a copy of the presentation when we're done. So if
mhm.
you wanted to see it a little bit easier, sorry, Geoff, go ahead.
Just wanted to
Here's the
point out there's
training.
an easy button to all this. Okay, um, there is an easy button, and you'll definitely get more on this later. So let's talk about our friends at Health Sherpa who created that link. They're the largest ACA platform out there, and we're not paid. This is not an infomercial for Health Sherpa. We just find their platform easy to use, and we can help you set it up. You probably realize all this. There's no redirect. There's no you know double action that you do when you enroll a client. You're going to be working seamlessly in the Health Sherpa CMS platform. Um, there's a ton of stuff to it. There's you can upload the documents for your clients. There's branding. There's marketing. There's dashboards that help you monitor your client base and track their activity. So much more. Just give us a call or send me an email, and we'll get you set up with Health Sherpa.
Yeah, and there's
And
a training too, right, Geoff? They actually have a
yeah,
training tab where you
yeah.
could see Amber, our rep from Hell Sherpa, go through it step by step. I watched
Hmm.
it. It was really
Hmm.
helpful to see it. If
Hmm.
you're still a little sketchy on it, it's a great way to see it. Just go to the training. And yeah, I think, Geoff, we'll include that link because I think both you and I already have it saved on our computer. So
Hmm.
that way they don't have to hunt and peck for it.
Hmm. Okay, so let's just talk briefly on Marketplace and the ancillary options. So we're just going to give you an overview of the whole shebang, okay? So Cornerstone, we now partner with 8 carriers on the ACA side, Aetna, Ambetter. Antidote is a new carrier out there. Um, Anthem, Carasaurus, Molina, Oscar, and UHC. These are all on the ACA platform. They all sell on exchange, and they all pay great commission. And we have partnered with these carriers now. Antidote is relatively new. We've had them for 2 years. But you have any questions, you want to get appointed with these carriers, let us know. We'll get the ball rolling on that. And we also want to point out we've got 6 dental carriers separate from the ACA. And these are standalone dental carriers. We suggest that maybe you look at standalone dental as opposed to the dental baked into the ACA products. In addition to that, there are still short-term plans out there. As you realize, short-term was severely curtailed starting September 1st, and short terms can only run in duration of 3 months with an option of a 1 month renewal. Um, at that point, you have to, leave that carrier. So, it doesn't leave a whole lot of options. We market Allstate and United Health One, okay, and you can access all this and more on our resource center. This webinar and more will be out on our resource center It's a great way to refresh on all the data that we share on these trainings. And take it away, Brad.
Oh, okay. All right. So we went through the exacting data out there by carrier. And so this is just so you can kind of get an overview of what to expect for seeing rates. So as you look at this, these are our four primary markets: Ohio, Kentucky, Michigan, and Indiana. And you can kind of see where everybody falls. I mean, Aetna in Ohio is taking a pretty whopping increase. So maybe them being new in the market, some of their actuarial values may not have been quite right. And so they've adjusted them. So just pay close attention for any of those of you who wrote any Aetna policies because the renewal letter your clients are getting is probably going to be a little shocking to them, especially the older they get, where the premiums get higher or not as highly subsidized. Um, Ambetter, WellCare, Celtic in Indiana. WellCare is in Kentucky. Um, they look actually very strong as you look across the board here. In Ohio, they're actually taking a 4.5% reduction, and in Indiana, nearly a 10% reduction. So we think that Ambetter and its other, statewide affiliates should do pretty well this year as a result. Anthem kind of comes in that standard range, except for Indiana, where they're also taking a 3% reduction. But 6 to 8% is the typical annual sort of cost of living adjustment or annual trend increase. CareSource, CareSource, as you'll see later, has really strong benefits, and we're going to actually show you a grid that might be helpful. But that 10% increase is a little bit higher than they normally would see in Ohio. But again, you really have to do the math, as I always like use that expression, because sometimes that dollar amount is incremental and compared to the benefits they get, it may be worth it. And then take a look at Molina. You're going to see in a little bit that Molina is having a great expansion in Ohio, um, and their rates are essentially flat in Ohio and Kentucky, Michigan. 8% increase, kind of standard Oscar, and that Oscar rate varies, right? Because we have it here. Oscar Cleveland, 7.5%. Oscar Columbus, a little bit more than 4.5%. And then as you see United Healthcare kind of in that standard range of 7%. So that's our core carriers in our core states. Next slide, Geoff. And I did this as a service to all of you. And Michigan has a ton of extra plans, so that's why the list is fairly long. But you can see in Ohio those sort of local carriers where they sit. AltCare coming in at nearly 10%. Medical Mutual. I don't know if that's a bad word right now with all of you, so I don't want to make a big deal about Medical Mutual because I know they punched you all in the gut here late last week.
Care.
Um, sorry. And then Suma, you're seeing, at over 10%. And Paramount, who that previously named carrier uh, is has acquired. So that will change or get rolled in 2026. But for now, they're operating as their own, and you're seeing the rest of the plans are pretty much all in Michigan. And out of all of these, one of the biggest ones, Priority Health, which is the Spectrum Hospital System, is taking a massive increase, nearly 19%. And CareSource is new in Michigan, and they have an alliance with HAP, or the HAP Health System. I think it's Health Alliance Plans is what that stands for. But HAP is seeing, or CareSource is seeing a lot of plan changes from Priority because of that, nearly 19% increase. So for those of you that sell across the border up north, then that's what it is. Sorry, I hate that expression. Don't know why I used it. Next slide, Geoff. So I am going to credit my source. This was actually CareSource. They do an annual presentation called the heat map. And so they do this in all the markets. We just have the five that they highlighted for Ohio that day. And it's based on the lowest premium silver plan. And not all lowest price silver plans are exactly the same, but they tried to match them up with nearly the same or that standard 80/20 uh, CMS standard plan, right? And when you're seeing some of these rates, gang, they're all based on a 21-year-old. So don't get all excited that people that mostly in our age range or a little bit lower are probably not going to see these rates unless highly subsidized, of course. So as you look at it, highlighted in green is that lowest priced silver plan or lowest premium in the market. So Cincinnati, it's Ambetter, and CareSource did this, but they're also the highest in Cincinnati, so $120 over what Ambetter is. And you can kind of see Molina's coming in at, plus $10, Oscar at about $19. And so you kind of see the range there of where things are. And there's only a couple of kind of lower priced plans, but these numbers can kind of extrapolate out, right? Really, it's showing where they fit, and you'll see this as we, move across. In Columbus, Oscar is the winner in Columbus, believe it or not. But when you look there, CareSource again is the highest, or nearly the second highest. Take a look at Medical Mutual, but so everybody below or higher than Oscar is at least about $22 higher. You look here in Cleveland, Molina is the winner, right? With the lowest premium, and Molina's actually expanded a bit more in Ohio or in this part of the state where they weren't always the sort of the bigger carrier. And the good news is they're going to pay you more commission, so you might see them be of more interest to you because they're paying kind of the standard, and we'll show you that. But you're taking a look and you're using this, and again, you're going to get this. I don't need to go through every one. In Akron, Akron looks like it's a pretty expensive area, where the next closest to sort of level is like 57, or excuse me, $29. And then we come over to Toledo, and here everybody's kind of relatively level in this market, with the two highest being in that plus $90 range, but everybody else is in the teens, 20s, and 30s. So Toledo is a good kind of level market. Next slide, Joe. So starting to talk about the carriers. If some of you have seen this when we did this presentation a few weeks ago, there's nothing really new here. So I don't want to keep you from running late for an appointment. So if you have to drop off for that reason, that's fine. But for those of you who are new, and I am actually seeing several names. So Aetna, again, $20 commission per member per month, and that actually gets paid via us. And there are a few carriers that pay their commissions through us, and we turn them around to you. One of the biggest highlights about Aetna is their use of I think it's like, Geoff, do you remember the number? I don't know, like 1,000 or a few thousand CVS Minute clinics.
Hmm.
So to use for kind of um, not really urgent care, half urgent care, right? Eye infection, different things like that. You don't want to go in and need stitches or anything like that, I don't think.
I got my COVID
Um,
shot there. Yeah.
well, COVID shots are perfect, or vaccines are
Yeah.
perfect.
Yeah.
Anyway, they are embedding in their plan a $25 per quarter over the counter benefit at CVS, and also offering some zero or low cost generics. Here's their network, kind of an overview of their network. Don't need to really go through that, because I think today you're all going to be getting an email that shows every hospital. We tried to get as many of them as we could. So they'll be there. You'll see that list. It's regionalized now, so it will be a little bit easier to follow for you. But Aetna actually has a fairly strong network. But again, remember, they're looking at an 18+% increase, so might be kind of hard for them this year. Next slide, Jeff. 15 new counties, so they saw enough enrollment that they wanted to expand. how the Minute Clinic works. It was 1,000 locations. I forgot we had it there, including those Minute Clinics that they have in the Target locations. And they're telling us that the wait time is about 20 minutes to get into the Minute Clinics. And if I'm not mistaken, because I've used it, you could actually make a reservation appointment. So you can maybe minimize that if your clients can minimize that if they know it. Their plans, interestingly enough, have adult dental and adult vision embedded in the plans. And that may have driven up some of that cost as well. The other good thing, in addition to the over the counter allowance, they're also getting a 20% discount on all CVS private labeled products throughout the year. So it allows them to extend that $100 OTC by saving more money along the way. Next slide, Geoff. So Ambetter, Ohio, probably our largest carrier or largest written carrier by all of you. Um, they kind of lead the pack. So um, really good network throughout the state. As you'll see, they're paying 20, which is kind of the standard rate. They're even paying 20 in Kentucky. There's the hospitals again. You'll see them all on the list. Next slide, Geoff. Okay, Michigan. This is a little fuzzy, so all we really wanted to let you know here, because we didn't track who's calling me. Sorry about that. I should have put that on mute. They have Henry Ford, they have Ascension, they have Beaumont, and in Grand Rapids area, they have Spectrum in Zealand. And if you can't, the newest county I think they added was it's St. Clair County that you see there in blue. It's a little fuzzy, but they're pretty much in all the counties that have a larger amount of peoples than trees in them. So that's Ambetter, Michigan. Next, Geoff. Kentucky, they're in a giant swath of the state. So again, they primarily use the University of Louisville network. I'm not down in the area like Geoff is. I'm told that the University of Louisville is a robust network throughout the state, as well as Norton. And they have St. Elizabeth in that northern Kentucky over the Rhine. No, not over the Rhine, over the river. Sorry. Okay, next slide, Joe. And better Indiana, they have every county in the state of Indiana. Indiana University Health System is throughout the state as well as the Ashkenazi, or I would say Ashkenazi,
Eskenazi is
but
more Indianapolis area.
okay,
This is
there you
just,
go.
yep,
Okay,
some
very
standalone
good.
ones.
All right,
Mm.
highlights. One of the biggest things that we find with Ambetter, they're changing the name. And if any of you attended any of our in-person trainings, the gold, silver, bronze plans currently are called the Core Network. It's now going to be switched to Premier Network. And what the Core and now Premier lets members do, um, allows them to go into other states and utilize their network in those other states. And Geoff, we should include the map of the United States, because I think if you draw a line eh, from sort of mm, New Jersey, Pennsylvania, across to Missouri, take a dive, and goes out to Utah, Nevada, Arizona, Southwest. California, just note, like New York, I just found out the other day, they are a division of Ambetter called HealthNet. So they would not have access to see providers in California or New York. That's all the ones that I'm familiar with. There may be others, but I think it's predominantly Ambetter or um, Celtic in Indiana and WellCare in Cincinnati. It's all the same. Broad network. Virtual services are offered by Teladoc, kind of the leader in the virtual care space. There's $1,000 of buy-up that are available, as well as an adult vision, as well as you can see there. Um, and if any of you are selling Off Exchange or ICRA, they've rebranded their Off Exchange plans to be called Ambetter Health Solutions. So a little bit different. Next slide, Jeff. Go back one slide. Okay, so the new kid on the block. One slide. There you go. The map.
I guess,
Sort of
yeah, let's
yeah.
start.
The new kid on the block is Antidote Health. They were off exchange for 2024, but this year they got the go ahead to go on exchange, and they've adapted their plans a bit too. So they're going to be in a total of 43 counties. 22 of them are new. So a very large expansion. Yes, you see when you get out to Northwest Ohio, it's not the whole section like it is in Northeast, Southeast, or in Central and Southwest. But they have, in terms of Cincinnati, as maybe their eh, least least robust network. They have Mercy, which Mercy
Yeah.
is in many areas of the state anyway, so they have them throughout the state. In Columbus, they have Mount Carmel, OSU, and
And I,
Nationwide.
if I could add in a, if I could add in a
Yeah.
typo, in Dayton they don't have Kettering, and it's just the Mercy
Oh,
system. They're hoping to get
okay.
Kettering, but it's not available just yet. So just
Okay.
hold
Good.
off
Thank,
on
thank you.
Kettering in Dayton. Mhm.
In Northeast Ohio. And the reason that many of you are asking to get contracted is because not only do they have Akron Children's and Metro Health and Mercy, but they have Cleveland Clinic. And just to note, gang, when your clients call in and ask their provider if they take antidote, they may not know that answer exactly. And I'm going to show you in the next slide why that is. And you see down in Southeast Ohio, their network is a leased network through Quality Care Partners, which is out of Zanesville. And so that's why they have that whole swath in that area. Again, they're on exchange this year. So it's a virtual first model. Your clients are going to save the most money if they start with virtual. And what they've expanded on this year, so virtual was always zero, but as you're doing a provider search, you're going to see tier one or tier two providers. Tier one providers that are PCPs are also going to be zero. So that's a new change. And you don't need to start with virtual in order to see a tier one provider. They're all the same. Virtually referred to a local PCP, again, that's going to be zero. Maybe that's actually virtually referred as zero, not going directly. Discounted copays, if they get virtually referred to that specialist, so they're getting a discounted copay. If they want to go direct, they can. They're just going to pay the highest level of copay. And I think we have that example coming up so you can see that a bit. And we also have their presentation, which maybe elaborates on it a little bit more. They've changed the name of their plans. They are complete and complete with dental and zero core RX. And they have the elite and the elite plus dental that has advanced RX, sort of a larger formulary, as well as zero cost virtually referred labs and flat copays for the physical therapy, occupational, and speech therapy. And so that's really good. They have chronic conditions plans for diabetes and hypertension. Some of the insulins most commonly used are going to be zero, and the related supplies, test strips, lancets, and I think you're going to see glucometers are also there as well. And hypertension are just getting, there's a whole wide swath of hypertensive medications. So you'll see those dental buy-up options available as well that give you up to $1,000 max, as you're seeing. Next slide, Geoff. So this next slide really shows how to access the network. So again, Quality Care Partners is the network they utilize. That includes Cleveland Clinic and all of the other hospitals that I mentioned. So when you use this link, qualitycarepartners.com/members /find a doctor, you're going to see the pop up on the left, antidote, click that on, and then you're going to be able to search. They're working on improving the search functionality. It's a little wonky. It doesn't necessarily work on a radius where you'll look for a doctor. If you're doing a zip code search, it will show that doctor and then it will jump to Akron. So there's some algorithm in there that's not quite right. But if you type in the names generally populate if they're in network. So sometimes that's the easier rather than hunting and pecking. The hospitals is where I had to do a lot of hunting and pecking because of that wonkiness that they're working on correcting. Next slide, Geoff. Geoff, I'm not paying attention to questions, so maybe take a look to see if there
Oh,
are any. Yeah, I didn't look.
mm,
So
I don't see any.
okay, good. Anthem, right? The largest provider in the state in terms of 88 counties in all. They're paying $18 per member per month, and that's capped at 2 members. So if you have a family of 3 or 4 or more, they're not getting any more than the $36 from the 2 people on the plan. So that's really important. Again, their network, you could see it. I don't need to read it, and you're going to get that spreadsheet that has all the entire network in all of the areas, right? Next slide, Geoff. So we're just highlighting some of the other counties that Anthem is in. Kentucky pays a high commission, $25 commission per member per month. You can see the network. Northern is St. Elizabeth, which seems to be. Geoff, are there other large hospital systems in Northern Kentucky that
Just one system in
there's?
Northern Kentucky.
Okay, there you go. So St.
Yeah.
Elizabeth.
Mm,
Got it. Louisville, you speak, they have University of Louisville as well as Norton, which we saw before. Another carrier in the Lexington area. They have University of Kentucky and the Baptist Hospital System. Next slide. Again, they're in a giant part of the state, except for the state that's on the border of Cincinnati. So that makes it a little bit harder for our Cincinnati area brokers or Southwest Ohio brokers. But again, they have Indiana University, Clarion, and it's, as you can see there. So that's it on Anthem. Next. All right. So some of the highlights for Anthem. Um, the 2025 engagement package 100, and Geoff, do you remember what that's all about? Sorry, I forgot
Oh,
to
well, wellness
research that all.
activities. Filling out a questionnaire. Um, you know, there's
So
some
like a health
other.
risk assessment.
Going to the doctor, your PCP, that sort of thing. Your
Okay.
typical wellness activities.
Okay. And for that, they get $100
Mm-hmm.
a credit or a gift card, something like that.
Mm-hmm.
Anthem Dental is one of the largest PPO networks in the nation. So even for standalone, you want to take a look at them as well for having that kind of network. They always tout their Sydney app, which is a mobile app that members can use, and they have a silver plan that focuses on heart patients. So you're going to see through most of the carriers, they're starting to focus on chronic conditions because those are the largest drivers of healthcare costs in the industry. Are those 5 chronic conditions, diabetes and heart being the 2 largest of the 5. So next slide, Geoff. CareSource. Again, 86 out of 88 counties. Knox is a difficult county for just about every carrier. I think Anthem and Medical Mutual have Knox Community Hospital, which doesn't really like to play with all of the carriers, and they're not in Athens. So down in the Ohio University area, they're paying a $21 per member per month. They do have a really robust network in Ohio. We're seeing a lot of activity with CareSource. They offer 2 children's hospitals nationwide, as well as children's in Cincinnati. Um, so why did we have they added Athens? Did they add Athens, Geoff? I'm going to have
I
to
don't
look at my
believe
sheet.
so.
I
I
don't
don't
think they did.
know.
I think they
That might
did
be a
last year
typo.
and they retracted it.
Mm,
Next slide.
yeah.
In Kentucky. So they're in a total of 6 states, including Georgia and West Virginia, which we probably didn't highlight here, but 22 p.m. Commission, and you can see the hospitals, and they're in. It looks like about half of the state, but there
There
are
was
some
some
spotty
pullback.
areas.
There was some pullback. They were in more counties last year.
Okay, They did
So
retract. Okay.
the southern
Next slide.
portion.
And again, I think everybody likes to be in all of the counties in Indiana. Again, their network is the
Mhm.
same. We will be sending, including a commission and bonus program. So you will see at the time Jeff and I created this, we didn't have their commission for Indiana, but that will be included in the follow-up material or the email blast that you're all receiving today. Next slide. And as I mentioned earlier, CareSource has formed an alliance with the HAP health system in Michigan, and they are in the 5 counties of Metro Detroit. Not all 6 of them, but 5 of them, as you can see there. Wayne County is Metro Detroit, and then up to Troy to the north is where you're seeing it. They have Henry Ford, they have Ascension, and they have the Corwell Hospital System. The names of the counties are there. They're pretty small to see. Shawassi is the one that's the hardest there to pronounce. So again, pediatric dental is included on all plans, giving them a first exam at zero copay, zero retinal imaging for ped dental, as well as zero for their first pair of glasses or contact lenses. So that's strong across the board for them. And um, they're introducing a brand new metal to the mix. They're offering a platinum plan, which they expect about maybe 5 enrollments, I think. So it's if you could imagine, if they have most things at zero or a lot of things included, or low deductibles, it's going to be it is a low deductible. It's going to be expensive. Our rep Tony assumed that it might be well into the $2,000 range for a single person in their 45 plus range. They do one of the things that CareSource got a lot of momentum from last year was their diabetic plan, which they got a lot of enrollment, and so they added another chronic condition, the Hearthy, and they're on their silver and gold plans. Um, they added a high deductible preventive silver plan. It's their only HSA qualified plan. Um, and again, on these chronic and high deductible plans, you don't need to be, you don't need to have those conditions. It's just the formulary is going to be skewed more towards those. But when I saw the premiums last year and what the copay features are, those 2 plans, a lot of people who were not a diabetic um, joined the plans because it just looked really good. They're also using Teladoc virtual care at zero, and for $3 to $4 more a month, they have a buy-up option that includes adult vision from iMed, and it's a $250 frame allowance or contacts, but it also has a fitness benefit from Active and Fit, which utilizes a lot of the larger gym systems like Planet Fitness, Lifetime Fitness, LA Fitness. Ones of the same ilk. You're not going to find like a Lifetime Fitness or anything that are super high, like a regular membership fee that's pretty high. Next slide. And so more on those diabetic plans, you can kind of see zero on screenings and tests for A1C, retinopathy, diabetic kidney disease screening, a lot of screenings, the DME, the glucose meter, I think it's the One Touch Vireo is the one that they're using. They also have Dexcom and Freestyle Libre, CGMs, continuous glucose monitors. That's the little button. It's almost like the nicotine anti or the what's that called? A nicotine patch. So it kind of works the same way and attached to your phone or a glucometer. Pens, needles, and lancets, all of that are included at zero. So you can see why it's uh, so well enrolled, and you can see the list of insulins. You're all going to get this presentation, so I'm not going to read every one of them, but you can see it's a pretty robust list. You come over to the Heart Healthy plan. Again, zero tests and screenings like lipid panels, metabolic panel, and even an EKG. Look at the list of drugs that are here too, and they were over there. Jardiance, Farxiga, Entresto. These are expensive medications. Why do we know that? Because they're advertised heavily on TV. So anything that's advertised on TV is not cheap. Um, like Enbrel that Phil Mickelson could afford, that was like $2,000 a month. So you get the drill. You've all been on formularies before. Zero DME like a blood pressure cuff, as well as compression stockings. So if any of you are playing soccer too, or your clients are playing soccer, they could use the compression socks as well. All right, next slide, Geoff. I don't want to belabor that. And here's that high deductible health plan. I think the deductible, if I'm not mistaken, was right around $2,500 to $3,500. So it fits in that range. HSA qualified, and you can see what they're doing here as well on the preventive drugs. A lot of these that you're seeing here are high blood pressure with ACE inhibitors, beta blockers, and then statins for cholesterol, as well as the anti-diabetic drugs are there as well. And you're seeing much of the same list there as well, and also diabetic supplies, kind of same as before. So the high deductible silver preventive silver plan is an amalgam of um, the heart health and the diabetic plan as well, in addition to being HSA qualified. Next slide, Geoff. I think you might be coming up next because I'm out of
Yeah.
breath. Thank
Okay.
you.
Take a
Sorry,
knee.
everybody.
Okay.
For taking me.
Uh, great job, Brad. Thank you so
Thank
much.
you.
I'm gonna Molina, one of our longtime partners. Again, they're paying generous commission. They're very competitive. We're seeing more action with Molina this year than ever before. Very strong network in Central and Southwest Ohio. Down here in Cincinnati, they've got Mercy and UC, and up in Cleveland, Lake and Metro. By no means are these the only comprehensive list of hospitals they have. They have more, but I'm just giving the highlights. You know, at Ohio State, they have OSU, and that includes the James Center. Over in Dayton, they've got Kettering System, and at in Lima, they've got Memorial. So a very strong network. And come on,
Geoff, can I
hold on.
interject something? Because I heard from
Go
our
ahead.
rep.
Yeah.
If you have clients that are using exclusively the Lake Health system in Cleveland,
Hmm.
just be cautious. They are in contract negotiations with them. So either they're going to get all of the university hospital system, or they're going to lose Lake Health. So just be cautious there, because
Okay.
I don't want anybody to have a client that's a problem that's irreversible until a year later. So just be cautious if anybody's using Lake Health.
Okay.
Sorry,
Fantastic.
Geoff.
And oh, no worries. And in Kentucky, you know, the Molina is a strong carrier, particularly in the Louisville area. They haven't come up to northern Kentucky yet. These are the three counties adjacent to Cincinnati, but they're very strong down the Louisville area, and they're branching out, as you can see, using the Norton and UL system down there. Okay, and some nice expansion there, and into 5 new counties. Michigan, um, they've been there for several years. Generous commission up there as well, and there you have it in Detroit, Corwell, Ascension, and Beaumont, and over in the Western Michigan, Grand Rapids area, they've got St. Mary's, Spectrum, and Metropolitan. Um, they boosted their commission, and in Ohio, they've added the Bronze Plan. We're so excited about that. They've got 15 new counties in Ohio, making a total of 78. They've added 5 in Kentucky, like I said, meaning they have 30 counties. And they got 15 counties in Michigan. They have a $200 reward program, doing your usual wellness activities out on their website. Um, they've got a drug saving solutions program to maximize your benefits. Of course, they have Teledoc like most carriers, and they've got a nice adult vision. It's a good vision plan through VSP, and gives you $150 for frame. Um, let's jump over to Oscar, another good partner of ours. Generous commission there, directly paid to the agent. They've expanded into Cincinnati, and I believe in Cincinnati, they've got Tri-Health and Christ. So don't quote me on that, but I think they've got Tri-Health and Christ down here. But in the Cleveland area, their flagship system up there is the Cleveland Clinic. So that's a partnership between Oscar and the Cleveland Clinic. So they're very strong, and it's a ton of providers up in the Northeast Ohio area. Down in Columbus, they've got Mount Carmel and Nationwide. And what's more, they've added some counties here, 3 in the Cleveland area and 2 in the Columbus area, or 3 in the Columbus area. My bad. Okay. They've expanded into these counties here, as I mentioned earlier. They have a $0 virtual urgent care benefit, and many commonly prescribed drugs you can get for as little as $3. Um, and they've got a great member um, member website, and you can pay monthly. You can search for care, do much more. Okay, and lastly, but not least, is United Healthcare. Very generous commission, $20 PM, direct to the agent. They've got a $100 reward debit card, and they've got a great discount at Walgreens on many OTC items. Check that out. They've got $0 ARP membership, which is huge. I mean, what do you need to be 50 years old? I think anybody can join ARP. So I encourage everybody to look into getting a free ARP membership if they can. And they've done some expansion into Cincinnati, Akron, Lima. And here we go with the networks down here. They've got Mercy and Christ. And Jewish is a part of Mercy system. So I just want to point that out. In the Cleveland area, they got the Metro and Mercy system, along with Akron Children's and Summa. Up in Columbus, they've got Mount Carmel and this doctor network called COPC. Dayton, they've got Kettering, and in Toledo, Mercy and UT. And they're also in Michigan. So down in the Detroit area, they're using Corewell and DMC. And some highlights. They did not expand in Ohio. United Healthcare did not expand in Ohio. They've got some cross-border coverage when you're up in the Toledo area into Monroe County in Michigan, which is nice. And the network remains the same, but we're hoping that they can add some more in the coming months and years. No referral required to see a specialist, which is really nice. So that's a nice kind of open HMO they have. Some plan highlights. They've got the copay focus plans. That's their top seller. The bronze plans represent about 45% of their sales. I'm not going to read all these, but you see them there. They've got a great diabetes management program, $0 for the first 8 visits, and $8 copays on formulary insulin. We got a fitness program and some OTC benefits through Walgreens. And take it away, Brad. That's it for me.
Okay, thanks, Geoff. Well
Easy.
done. Well, yeah, there you go. So Geoff covered all the stuff that he's good at. The Health Sherpa, because he sits on calls with Health Sherpa and actually with the marketplace. So he's our resident do-gooder. Um, so ICHRA is kind of the hottest topic in healthcare right now. So individual coverage health reimbursement arrangement is what it stands for. I know many of you have been hearing about it. It's had 400% growth, but that's going from 40 members to 400. So it's not huge, but it is getting a whole lot more interest as traditional group or MIWA plans are seeing fairly decent increases year over year, right? And so they're saying, I just need to be in more control of our budget for healthcare for our employees. So ICHRA allows them. If they're under 50 employees, they can define an amount that they want. And if it's 50 employees or over, they have to use an availability or affordability calculation, which is set at 9.02%. So it's deemed affordable if it's that or less. If it's over, then it's not affordable. They can join a marketplace plan if they want in that regard, or um, the employer would just need to contribute more to get them to that affordability calculation. So the good thing is we have an ICRA specialist on the team. Her name is Lael. She's really good with ICRA. And we have a few different setups where we can help you, we can guide you, or we can do it for you. And Lael can expound on those a little bit more if you need to be put in contact with her. And I've done that several times this week. Um, we can help you there too. Also, if you want the full-on ICRA presentation, Lael did one. I think it was about 75 plus minutes about a month or so ago. Massively attended. That's a lot of the interest that's there. So it's really a great program to consider for those of you that are facing those high repeated annual rate increases in the group world. And I think for those companies that are multi-state, it's probably easier for them to offer something like this for their um, maybe just for their out of state members that they have a sales rep in Nevada and they have somebody in Illinois, but their manufacturing is here in Ohio. So it's a really easy way to do that because they can have a defined employee benefit as well as an ICRA plan. They just need to have a certain amount of members on ICRA. So I've already said more than I thought I was going to say on ICRA, but just go and watch the training or we can get you connected with Lael. Next slide, and I think it's the last slide. This is what I've been talking about. Geoff, Carla, and myself have spent probably about the last month working on these to try and get them out to you. So there's going to be maps for the 8 carriers that we have, as well as we did a grid. So if you just want a couple pager that shows the expansion illuminated there in a kind of orangey salmon color. And we have the hospital provider network list, which has all 4 regions of Ohio, as many hospitals as I could find. And there's a lot that are a part of a system. So we listed them as a system, knowing that all like Mercy is probably that one. It has many different names throughout the state. Some are community hospitals, some are a saint name like St. Mary's, St. Rita's, all of those. It's a really great list. That email blast should be in your email box today, where you'll be able to download those forms. And we try to keep them, except for the maps. They're all like 2-3 pagers if you print on 2 sides. So it's a really great resource to stick in your bag, pin to your wall like Geoff likes to do in his cubicle. And I think that was the end of the presentation. Sorry we went a minute over, but questions, Geoff? I don't know if you've been looking. I
Yeah,
don't.
I didn't see any questions that pop up, but I think some will filter in. And I just want to bring up a couple questions, couple topics, couple comments. And this is kind of an open-ended question I have for Brad. In light of the election, President Trump, um, President-elect Trump, you know, has at various times made comments about the insurance market, the Affordable Care Act, you know, so what's your prognosis, Brad? What's the impact of the Trump administration going to be on the Affordable Care Act?
We'll know it when we hear it, really simply, right? I mean, and the thing that Geoff and I debate, and we don't want to be political, but I know for a fact that no politician wants to take their career sword to end their career by getting rid of any program that's already been offered. Will it get reduced? Maybe. Don't know that yet. We're not going to know that until probably September of next year. You might hear about it in the news, but the real effect, uh, we will not know. So just be optimistic, remain optimistic. It's not the end of the world. It's just a change. That's all. So that's all I'm saying
Yeah.
about politics.
And so I got a question yesterday. Is the ACA going away for 2025? Absolutely no. Absolutely no. It's here for 2025. So, in my opinion, it'll be here for 26, 27, 28. But it is definitely here for 2025. The subsidies are in place for 2025. The fully enhanced subsidies are in place for 2025. So the great unknown is if Congress will renew those enhanced subsidies for 2026 and beyond. Okay. If they don't, we will see some price increases undoubtedly, but let's not worry about 2026 just yet. We will stay on top of this issue throughout the year. We'll be providing updates throughout and any other legislation that comes down the pipe. In my view, just speculating here, I think ICRA is going to get a real boost from the Trump administration. This was a program that they introduced back in I think 2019 or 2020 before the Biden administration, and it's gaining speed, it's gaining ground, and I think this might be an area of focus for the Trump administration. So um, we are your ICRA hard for me to say. We are your ICRA experts, right, Brad?
Yes, or know enough
And
to be dangerous.
come to us with any questions you have about ICRA. So that's
So
my
that
two
kind of says
cents.
that if ICRA is going to be good, it still needs the marketplace in order to be saleable. So there you go. Last parting
Okay.
shot. Everybody,
Um,
thank you for joining us. Are there any questions? I did see one pop up.
okay. It was more of a comment. Uh, okay. So it sort of echoes my comments. The Affordable Care Act is here to stay. But it needs to be more affordable. I agree. I totally agree. It needs to be more affordable. So, um, fantastic. I really thank everybody for joining us today. And any final thoughts, Brad?
No, thanks for joining us. Sorry we went over. But have a great rest of your week. Happy selling as always. And we will see you again. I don't think we have any more training scheduled for the rest of the season, but we will be back at it in January. And we're also going to have a couple of expos next April. So be on the lookout for communications and save the dates next year for next April. So that's still TBD, but we know we're going to do them. So thanks, everybody. Have a great rest of your week. Bye.
Bye.